Hey guys, welcome back to my channel. Now I'll tell about right occipital posterior position, which is the most common position. Okay, if examiner gives you, tell me the mechanism of labor in this position, then you'll say here the fetus is in longitudinal lie cephalic presentation. The presenting part is vertex and engaging diameter is suboccipital frontal, because in occipital posterior position generally we'll see suboccipital frontal or occipital frontal as baby comes out by face presentation, right? Okay, so baby comes out by face, but initially the presentation is cephalic presentation. Okay, so suboccipital frontal or occipital frontal is the engaging diameter, and the diameter of engagement is right oblique diameter. Okay, now coming first, there is engagement, then there is descent. Okay, then there is flexion, there is descent, there is flexion, and there is interrotation. So interrotation can occur 2/8 of the circle. So I'll show you like this. If you see like this, you can see, yeah. So this is right occipital. Okay, this is right occipital posterior position. So there is interrotation, 2/8 of the circle if it occurs, like 2/8 of the circle if it occurs, and the head comes behind, the occiput comes behind the pubic symphysis, that is complete interrotation. If this occurs, then there is delivery like normal delivery. With after interrotation there is delivery of the head by extension, and there is restitution, then externalization, and delivery of the shoulders occurs followed by that. Okay, so that is normal. If that is a complete rotation. If there is non-rotation, if the right occipital posterior position, if it is remain like that only, that is known as oblique posterior arrest. See, this is oblique, na? So that is oblique posterior arrest. That is one thing. Second thing, there is incomplete rotation. If the rotation is occurring, rotation occurs at ischial spines, right? So in the ischial spine, if the rotation occurs incompletely, so if the head is like this only, okay, it is like this, that is known as deep transverse arrest. In this condition also we'll take for cesarean. Third thing is malrotation. Malrotation means from the right occipital posterior position it enters into the direct occipital posterior position. Okay, in case of favorable condition, the head is delivered by face to pubis position. In case of unfavorable, it get arrested there. That is known as occipitosacral arrest. It is known as occipitosacral arrest. So what is the face to pubis position, which is favorable condition? Face to pubis position means after the head moves, there is malrotation. After the head moves, descends, the nose of the baby hinges behind the pubic symphysis, flexion occurs, and baby is delivered by brow, vertex, and then occiput. Brow, vertex, and then occiput. Okay, and face, remaining part of the face is delivered by extension. Okay, only thing, once the root of the nose is hinges behind the pubic symphysis, brow, vertex, occiput comes out, and remaining part of the face comes by extension. Okay, so there is 1/8 of the rotation from this side to here. Now, so there is 1/8 of the rotation. So 1/8 of the head again goes restitution back. Okay, and remaining one now the if you see the hands, shoulders, they are in oblique diameter. So shoulder should come in AP diameter. Okay, the shoulder should come in AP diameter. So there is external rotation of the head which is visible because of internal rotation of the shoulders. Okay, and the anterior shoulder is delivered, then posterior shoulder is delivered, and remaining part of the trunk is delivered by lateral flexion of spine. Okay, this is about OP position. I'll just repeat the things, different rotations. So right occipital posterior is the most common position. So in right occipital posterior position, it can rotate, complete rotation occurs 2/8 of the circle and deliver like normal occipital anterior position, or else there is incomplete rotation. So there is deep transverse arrest, or there is persistently non-rotation, persistently represent like that is known as oblique posterior arrest, or there is malrotation. It can come into direct occipital posterior position. Okay. That's about occipito posterior position and face to pubis. I'll just tell you about face to pubis delivery. So in the case of favorable condition in occipito posterior position, direct occipito posterior position, in case of favorable condition, the root of the nose hinges behind the pubic symphysis and brow, then vertex, then occiput comes, and remaining part of the face delivered by extension. Once the baby comes out, there is restitution, it again goes there, and shoulders come into the posterior position, rotate internally, and that is visible externally as acceleration of the head, and shoulder comes by lateral flexion, remaining part of the trunk also delivered by lateral flexion of spine. Okay, thank you.